If you have pain, numbness, or tingling into the wrist or hand, you may have carpal tunnel syndrome. So in today's video, I'm going to teach you how you can test yourself, what the causes and symptoms are, and the best stretches that you can do to get rid of your carpal tunnel syndrome for good. So if you're excited to learn more, let's dive right into it. Hey guys, welcome back to my channel. I'm Jessica, an athletic therapist teaching you strategies and tools for living a healthier and happier life by staying injury and pain free. So if you're new here, consider subscribing. Carpal tunnel syndrome is caused by pressure on the median nerve that runs from our cervical vertebrae C5 to T1, and it runs down our arm and into our hand. It innervates your thumb, your index finger, middle finger, and half of your ring finger. And the carpal tunnel area is referred to specifically this area right here in your wrist. You have your carpal bones, and then you have a transverse carpal ligament that runs across here. And if there's a compression or tightness or narrowing in this area, that's when it can compress that median nerve in this location and cause that tingling or numbness into the hand. I'm going to show you two quick tests that you can do yourself to see whether or not you might have carpal tunnel syndrome. Now, this does not replace a therapist, so if you're not sure what's going on, please make sure to visit your therapist to get it assessed. So the first test is a Phalanx test. This test, you're gonna place the back of your hands together and you're gonna hold this position for 60 seconds. After the 60 seconds, if it reproduces your symptoms, then this is a positive test. The second test is Tunnel sign, and Tunnel sign is essentially making a fist. You'll notice that you'll have your tendon running down into your wrist. Just go medial to that, so more towards the thumb. And what you're gonna do is you're going to tap on that area. This is right where the median nerve comes down and innervates the hand. If you have pain with this and it reproduces your symptoms, then this is a positive test. So what causes carpal tunnel syndrome? Well, there's a few things. The first one and most common is if you've got an overuse activity. So usually we see this with people who are working at an office desk and maybe they're typing throughout the day and they start to develop a lot of tension in through their forearms, their flexors specifically on the front side. And this can now create that tension between the bones as well as that ligament that I mentioned. So it's essentially narrowing of that area in the wrist. It could also be your first rib. If that first rib is elevated, this will put compression on the median nerve as it runs down from our lower cervical spine into our arm. And if our scalenes are hypertrophied, so if there's more tension in the neck, this can now compress that area and we don't have enough space for the nerve to run down into the arm. So that can also cause compression up here, and that can be kind of like a double whammy with the wrist and the neck. And our cervical vertebrae, so like I mentioned, C5 to T1, we have the nerve root distribution that runs down into our arms. So if there is an injury or compression in that region, that can also compress that nerve. And this can also be because of poor posture. So this is something that we're gonna work on when we go through the exercises. So we're gonna get right into these stretches. And for the stretches, I want you to hold all of them for 3 sets of 30 seconds. The first 3 stretches that we're gonna go through are very specific towards the wrist, and the 3 other ones are gonna be more of a global stretch. The first stretch that we're gonna do is for the flexors of our wrist and forearm. So as I mentioned, if you've got that tension through the front of the arm and it's maybe from overuse activity, this will really help you out. So what you're gonna start with is extend the elbow, and then you're going to use your other hand to extend the wrist, and you're gonna maintain extension of that position for the 30 seconds. With a stretch, it should just be a gentle to moderate stretch. You do not want it to overpressure it where you're starting to elicit pain. If you do get any pain, back off from the position and just have a little bit of a lighter stretch. We can do the extensors of the wrist as well, which is still maintaining that extension of the elbow and then flexing and holding the back of the hand now as well. So if you feel that you've also got tension on that side, you can do the same thing. The second stretch is a prayer stretch. So you're gonna place your palms together, and then I want you to have your fingers spread apart. And then now what you're gonna do is you're going to bring your wrist down towards the floor and then elevate your elbows. This is gonna create that stretch in through your fingers as well as through the forearm. You might even get a little bit of tingling with this, and that's okay. hold that one for that 30 seconds and then you can relax. So the third one is a soft tissue mobilization technique. It is a technique that a lot of us therapists use in the clinic, and it's great to help mobilize the muscles and fascia and the tissue that's all kind of adheres together. And so what it looks like is essentially you're going to start with your wrist and your elbow in flexion, so in a shortened position, and then you're going to kind of gently with your thumb or your index fingers, you're going to pinch the muscle, and from basically all the way from your elbow to your wrist. And you're going to then, once you've got a pinch grip, you're going to extend the elbow and extend your wrist. And you should feel quite a bit of tension in through that area. That is basically the whole idea. We're trying to release that area and make it a little bit more supple for the tissues and for the nerve to run through. You can do this 3 to 5 times in one specific spot, and then you can work your way down the forearm. The fourth stretch is a pec stretch. This one you're going to clasp your hands behind your back and you're going to try to rotate your shoulders into external rotation and try to pull the shoulders back and down. This is going to just help to open up the front of the chest. This will be great for any tension if you feel like this is more of a postural issue, maybe it's more from work. This is going to be great to help release that tension through there and allow the median nerve to kind of move more freely down into the arm. The fifth stretch is a scaling stretch as well as a first rib technique. You're going to need a long towel and you're going to place the towel underneath your bum. You're going to sit on the towel and then you're going to wrap the towel over the affected shoulder and you're going to grab it with the opposite hand and you're going to pull down towards the floor. Then what you're gonna do is you're gonna side bend your head away from the affected side, and then you're gonna rotate and look up towards the ceiling. This is going to be great at helping to lengthen those tight scaling muscles and help to kind of reduce that tension that they're placing on that first rib. This one you can hold for the 30 seconds, or you can do it as a mobility exercise where you're rotating and holding that position for maybe a few seconds and then coming back out of it and then doing that again maybe 10 times. And our last one is a median nerve flossing exercise. This is the nerve that's affecting our arm, and so if we can help to loosen up the tension or adhesion around that median nerve that runs down into the arm, then this will remove that tingling and pain that you're having down into the hand. So this one you're going to be sitting down or standing, and you're going to extend your elbow and wrist and reaching out as far as you can, and you can reach at 90 degrees or slightly above if you want to get a little bit more of a stretch. And then you're going to side bend your head away from the affected side. This is going to lengthen and put the median nerve on its most tension, and then hold it for a couple of seconds and then come back to neutral. Do this one 10 times because I think initially if it's quite sensitive, I don't want you to hold it for the 30 seconds. It might be too much to start with, and then you can work on building that up over time. By the way, if you're getting value out of this video, hit that like button and comment below and tell me which stretch you liked the most. So when it comes to prevention of this injury, one of the main ones can be postural. Like I mentioned, if we can improve your posture, if we can improve your thoracic extension and maybe work on external rotation of the shoulders, that's going to help to open up the front of the chest. If we can reduce some of that tension maybe in the neck, if you're dealing with a bit of a forward head posture. And if you are and you find that this is you, I made a video actually last week that I'll link it above and I'll put it in the description below for you to check out, because this will also really help you out with those specific exercises. And then if you find that you have a lot of tension in the forearms more so than it's a postural issue, then reducing the amount of pressure that you're putting on the forearms will really help. So maybe using a heat pack to kind of increase circulation in that area. And of course, these stretches are going to be super beneficial long-term for helping with prevention. Thank you guys for watching this video. Please like it if you liked it, subscribe if you're not already, and hit that bell to get notified when I post weekly videos. And I'll catch you in the next one. Bye. It's the best way to do it is that way you don't have to hold it behind. So this is the nerve that is affecting. So the other thing that it could be is this, and it's normally going to innervate, well not normally, but it innervates that you're having difficulty kind of lifting or gripping or pinching anything. Okay, let's relax.